Hello and welcome to Aging Insights. I'm Kathy Rowe, Executive Director of New Jersey Advocates for Aging Well, and today we're going to talk with a group called the Adult Children of Aging Parents. We have with us Frances Hall, the founder of ACAP, and Lorraine Montalbano, the chapter coordinator for Bergen County. I want to welcome both of you here today, Lorraine and Frances. I'm so glad you could join us.
Thank you for having us, Kathy.
Yeah.
So let's start. Tell us about ACAP, which is much easier to say than Adult Children of Aging Parents. Tell us about ACAP. How did it get started?
Thank you. Thank you for having us here. Kathy, I was the caregiver for my mother who moved from the home she grew up in Alabama to North Carolina to be near me at the age of 89. So it was a very, very difficult transition for her, and certainly harder than I ever anticipated that it would be, because I grew up knowing and wanting to be my mother's caregiver when we got to that point. So she comes to North Carolina. I was working full time, newly married, and found that juggling work and new family and my mother and occasionally, some time for me, that it was just not working very well. Mm-hmm. But what I found is that I wanted to help my mom, but I didn't know how. I didn't know who could help me help her. So I started inviting. I was working at a small university. This was in 2010. I was working at a small university in North Carolina and started inviting other faculty and staff to come join me once a month. We started doing that really just as a support group. And quickly I realized all we're doing is sitting around belly aching. And so started inviting speakers to come in, and it was just random. What did I need? What did I need to know? And that's who I would bring in. Well, that started growing, and I started hearing people from the community say, we can't get to campus for a lunch and learn. When are you bringing it into the community? And so in 2012, I brought it into the community, started the programs, the educational programs in the community once a month. And within 4 months, the group grew from something like 13 to 45. And I thought, something is here. And it has continued to grow. A woman started coming who was a PhD disabilities specialist. She was the caregiver for her parents, and she started coming and realized there's something really here. And it helped put it together, put the curriculum together. Together, we did the 501c3 and really started getting it going, ready to go elsewhere, having no clue that would happen. Pennsylvania was our next chapter in 2015, and then pretty much every year we have grown at least one, but it's almost like it's really taking off at this point. Right now we have 15 chapters across the country, and by the end of the year we will have probably 20, literally across the country. So that's how ACAP started, and I'll let Lorraine talk about how she got involved and how we developed the New Jersey chapter.
Okay. Thank you, Frances. Thank you, Kathy. So mine is a personal story as well. I became a caregiver for my older sister out of the blue. It was during COVID. We really noticed it right after COVID. So we didn't see each other that often that we picked up on it, and it progressed quickly. And I had no idea. I had no training. I had no idea who to talk to. Luckily, I had some professionals I networked with previously that I gave them a call, and that were in senior services, and they were able to give me some direction. But I would have been so many things I would have done differently if I knew what was out there at the time. And so when I got done with, I decided I wanted to give this back somehow to the community. I've always been involved in community service, and I kept hearing from other professionals there's not enough resources for the adult children. So I happened to be scrolling through my Facebook feed in the seniors real estate group I belong to, and another realtor mentioned ACAP and what a wonderful resource it was. She was familiar with it from one of the other chapters. So I picked up the phone, gave Francis a call. We had a lot of discussions, a lot of training. And it took me about a good 6 months or so because I needed to get a leadership team. I needed to have a leadership team of 9 other professionals who want to give back to the community and realize how important this is. So that's how we got started. And that was about 3 years ago.
Wow. Well, first, thank you for bringing it to New Jersey. It's definitely needed here. And I'm sure you know what you both described. I mean, this is what we now call the sandwich generation. You have defined it and you have lived it. And it's great to hear how this comes out of your personal experience. So, as you're doing this and you're doing your work, what do you see as some of the challenges that adult children of aging parents face?
I'm going to say that it is crisis driven, that they are not, that suddenly mom and dad one day are fine, and then next day someone has a fall, in the hospital, they go into rehab, then the hospital says they're getting discharged, where are you going to go for rehab? They're like, I don't know where to put my parent for rehab. They have no idea about what's good, what isn't good. And then what happens after rehab? Can they go home? Does the home have to be modified to be safe for them? Do they need in-home care? Are they going to go live with their children or in a senior community? And then on top of all that, if they cannot go home, then the adult children usually has a process of not only dealing with the parent, but the house as well.
Right.
That I'm sure has not been cleaned out in over like 20 or 30 years.
Right.
So that's a lot to deal with at once.
Yeah, and a lot of it, like you said, it happens suddenly or a crisis. It's not like something that many people have the chance to plan. That say, this is what I would want to happen, or in 5 years, I want to start clearing out the house. It comes up very suddenly and unprepared.
Sort of like what Lorraine was talking about, that there is so much that happens with navigating healthcare and medical needs that we don't have a clue. A lot of times we don't have a clue about the diagnosis or treatments or medications, and we have to fast try to learn all we can about what's going on. We hear a lot about how difficult it is to coordinate medical appointments. It's 15 doctors, and it's physical therapy and occupational therapy and all of these other pieces that we're trying to put together. And certainly if there is a chronic condition or a dementia, and Alzheimer's or whatever, there are a lot. I mean, that just compounds the complications of trying to manage all of this. Certainly, there is this whole thing about multiple roles. I talk about the juggling act. Trying to juggle the caregiving with the family, often working. At some point, you have to have some time for oneself. And trying to juggle all of that or balancing all of those roles. Certainly, there are a lot of emotional, there's a lot of emotion that goes into this. This is mom and dad. Wait, they're supposed to be infallible. They're not supposed to ever need me to step in. And so not only are we trying to manage things for our parents, but there's this grief process that's going on within us. That we are finding ourselves that the roles are changing, and we don't know how to do that, and we don't know what to do with all those feelings about all that. Certainly, the whole financial and legal piece. What about accounts? Where is the money going to come from if somebody needs more assistance, either in a home or a different location? Coordinating services, particularly if they're in a home and they need somebody to come in. How do you find the people that you can really trust? And how do you know that you really can trust that person to be in that person's home, in your loved one's home, without any supervision? Just open your door to strangers, if you will.
Yeah. Right. It's challenging. You need help. But then, how do you know what help you need? How do you find it? How do you find someone that fits in with your family, your parents? Because not everybody would be a good fit to come into your household. So I think that's very challenging for people.
Absolutely. And then there's some cultural things.
Exactly.
Depending on who you are and who your family is or who your loved one is, there can be some cultural dynamics that are really, that there are some real sensitivities to that.
Yeah.
And in all of that, then you get families, you get siblings involved, and holy mackerel, that could be a whole ball game in itself.
Yeah.
That you think one thing and sibling or a sibling thinks something different, and that can be huge. And then in the midst of all of this, it's exhausting. It is exhausting to try to do all this juggling act. So there are lots of pieces of this that the caregivers are trying to juggle.
Yeah, it is a lot. And I'm glad you pointed out the emotional side of it too. I remember with my mother, and even though she was in assisted living, there was a time when I realized I no longer have a parent. I'm acting like the parent. And I remember when it happened. That is quite a monumental event when you realize that the roles have switched and you're now the adult caregiver. It's very challenging.
Right. It is. And the reality is that our roles never really switch. They're always going to be our mom or our dad.
Right.
But at the same time, those activities switch, and it feels like we've become the mom or dad. It is a very, it's just a very confusing time. How do you do all of this?
Yeah, very good points. So, Lorraine, with what you have brought to Bergen County and you've set up, tell us more about it and how can people take advantage of what you're doing in Bergen County?
Well, we meet once a month in person, but we have also just started live streaming the programs as well. So someone cannot come out, they can listen to it, and at least they can then get their questions answered from the expert that's speaking while they're on the live stream, which we thought was very important. But there's also our website, ACAPcommunity, and you can search for the Bergen County Chapter there, and we have all our upcoming events on there, and so you can certainly find the events there, and they can visit our YouTube channel to find previous videos, as well as ACAP's parent YouTube channel has loads of information and blogs on it.
And, for our audience is all throughout New Jersey. So if people aren't in Bergen County, it's like they can listen to live streaming, and that is a great way for people to learn more. But how can we get more of this throughout New Jersey? What can people do to open either another chapter or build off of what you're doing?
I'm going to let Frances do that because there is another chapter coming.
There is. In Burlington and Mercer counties, is that
terrific?
Down in southern New Jersey, yes, they will be starting. They will actually be starting in the fall. They are in the midst of their training right now. So yes, if somebody else in a different location is interested in a chapter, all they have to do is get in touch with me, and they can find me either through the website or my email is fhall@acapcommunity.org. Just let me know that they are interested. I'd be happy to talk with them about that. Yeah.
That's terrific.
And like Lorraine said, there are lots of pieces on the website that if they're not interested in starting a chapter, because quite honestly, that's a pretty involved process, right, Lorraine?
Oh, yeah. I have so many people who are interested in it, but when I tell them the process, they're like, I don't think I have time to do that.
Yeah, I mean, very honestly, it is involved. But if somebody is not interested in starting a chapter, then we have tons of resources on our website, including we record a podcast every month that has something to do with caregiving.
Oh, that's great. We will share that out through our network too. And when you're doing your programs, what experts or topics are the most popular? Not just in New Jersey, but what do you see in all the other chapters?
Okay. Well, I can talk for New Jersey then. Frances, you tell me the same. Basically legal. Any elder care attorneys, everything legal for them to know what papers they need to have. How many people have not done their estate, that their parents have not done their estate planning or their power of attorneys. which is very scary. So it's educating people on that, and also I want to say dementia is a big topic. So many people are being diagnosed with that, and how to take, especially how to act with your loved one, what to say, what not to say, what to do, different ways to approach them, like never come up from behind and stay in front of them. Don't stand off to the side when you're speaking to them. There's so many little things that the children could use to get educated in. I want to think home health care is another big one. In home health care, all the differences between that.
Okay.
And I want to say Medicare and Medicaid, and also what Bergen County services are available. Because Bergen County, we are lucky that they have a number of services for the adults.
Yeah.
Right.
Yeah.
Yeah, I would echo all of those. But others that come to my mind, we have a list of about 12 programs that, regardless of where they are offered, seem to attract the largest groups, which says the people are really interested in them. Anything about dementia, absolutely. Falls prevention, how do you keep somebody mobile? How do you keep them upright? We also see a fair amount of interest in anxiety and depression, because so often that seems to accompany getting older. We have a fairly new program about coming home from the hospital. What do you need to know? How do you do that? That has been a really popular one. There are several others, and I'm drawing a complete blank on the others at the moment. But yes, there are some programs that regardless of where people are, that it seems to be that those are the ones that people really gravitate toward.
Okay, so the universal concerns, no matter where people are living, yeah. Because,
Yes.
I mean, aging is universal. It's just where we live depends on the resources we have, but we're experiencing the same issues all over.
Exactly. And our curriculum, the programs that Lorraine was talking about and that I was describing, really our curriculum is based on AARP and NAC's Caregiving in the U.S. that comes out, of course, every 5 years. And there is a table in there of all of, thousands of caregivers are surveyed. And there is a table about the kinds of needs that they identify as being the key needs, educational needs that they have. And that really is the basis of our curriculum.
So I know you both have significant experience in this now, and all the people that you've seen, the programs you've done. Do you see the needs of caregivers as predictable, or are they unpredictable? Is there a single path that people should expect to follow?
Okay, I'll take predictable.
Okay.
Well, predictable is there are certain things are going to happen with aging. Your health is going to decline. You may have some memory loss. You may need help in the home. You may need to, modify the house just to make it safe to live in. Those are all predictable. We know these things are going to happen as we age, more than likely. So you could plan ahead for those, or at least have a plan in place for those, to take care of those. But I'm going to say the most hard part is that it's all crisis driven. Usually when it gets involved, when children gets involved, it's usually crisis driven, and none of that has been planned for already. So that's what makes it the hardest. And Frances, you want to handle some of the unpredictable ones, I think.
Well, I'm just going to sort of echo, Lorraine, what you just said, and that what happens is that the unpredictability comes because, as I say, that a phone can ring. Everything is fine, but the phone rings and people's lives change dramatically, instantly. Mom has fallen and broken a hip. And that has this cascade of, well, can she come back home, or does she need rehab, or does she need longer term kind of residence? Dad has gotten lost coming back from the barbershop he's gone to for 25 years. What does that mean? How do we do this? And that also has all kinds of things like, what about his continuing to drive? Can he stay in the home? And as dementia progresses. So what we see, the unpredictability is that it can happen in a moment, and it can happen. The intensity of it, even we'll have a lot of people who will go home for holidays, or see parents on holidays. But come January, they are at ACAP programs and they are scouring the internet for whatever they can get or support, because they have realized that, when I saw mom or dad, several weeks or months or a year ago, we were okay. But all of a sudden, we know that there is a real change in their situation. And so the intensity is difficult to deal with, the suddenness of it, that those are the kinds of things. And then not only dealing with them, but dealing with whatever that situation is, then trying to figure out, well, what does that mean in my life as a caregiver? What does that mean in terms of my spouse or partner or kids or job? All of those kinds of dynamics come in. And how do we get family involved? And it may be that that the whole family is mopping along for all these years, fine and dandy, everybody's one big happy family. But then when there needs to be real decisions about healthcare for parents, things can get very complicated very quickly.
Right.
That's so true. And I'm going to just touch on the January that you talked about. That is so true. We notice that, and that's why we do a health fair every February as a cost fair, and that is growing in numbers each year, because that is the time where people usually they most become aware of it.
Yeah. Because some people, if we're not near our parents, we don't see them every day or every week. Like if you see someone every day, you might not notice the change when it's happening slowly. But if it's been 6 months or just like the holidays, a year, you can see how much change has happened over a year, where maybe your other parent who's living with them or a sibling who's living nearby hasn't picked up on that because the change has been so gradual. But when you see someone for the holidays or for an annual visit, then you notice the change from the last time. So I think that's really important to call out. And because of that, I think what sounds to me like it's helpful if I live in New Jersey in Bergen County, but I visited my parents in another state, the programs, the information is the same. It might not be the same local resources, but the information you're sharing and the programming, like the legal aspects or how to approach someone with dementia, they're the same no matter where we're living, right?
Right. It is not quite McDonald's or Burger King that you go in and you order a Whopper and it's going to be the exact same. Right. But yes, our curriculum has 67 programs, and all of our chapters are offering those programs, that the programs they are offering is coming from our curriculum. And we have an outline of what we are asking them to do and what we are asking speakers to present. And the programs are presented by local subject matter experts. And they are bringing evidence-informed information. It is not a thinly veiled commercial for anybody or any business. But the speakers, the leadership team, and we also encourage chapters to have sponsors. And so all of these people are in the senior space, in the senior care space. And so all are offering not only good information, but also providing resources for people in the local community.
Good. Very good. So I want to talk about the children more. It is interesting when adult children take on these new roles and they're caring for their parents. Let's talk about that a little bit more, what it means for the adult child.
The one thing you want to be conscious of as the adult child is that, we go through different phases of life. And David Soleil, who has wrote How to Say to Seniors, has that the two main phases of life for the seniors is what they have to deal with at that age is maintaining control in a world where most control is lost and leaving a legacy when there isn't that much time left.
Wow.
And you got to try to, as the child, keep that in mind. I would recommend anyone reading his book. It's wonderful. And just to keep that in mind when you're dealing with, even though we tend to want to make decisions fast, quick, check off our list, move on to the next thing. But your parents don't act that way. They need some time to think about things, and they need to know that they are in control. Even though wherever they can, wherever you can let them be in control, let them be in control. It is their life. And they do have the right to make bad decisions if they want to. I know we don't like that, but they do.
Yeah, and that might be hard to watch, but that's a really good point. They're still adults, and they have the right to make decisions. They can be tempting or sometimes easier, especially when someone, has younger children. They're used to caring for children. They, when you make all the decisions, you do all the planning, to then apply that to the parents, that's not a good idea. That's not a good approach.
Right.
Yeah, we can't do that. I used to say that never, ever, ever do you compromise on safety. And then I realized, there are times that what may seem unsafe to me is really important for my mother to be able to exercise control. It's her life, and she gets to decide that. But you're right. You are right, Kathy. That is hard to watch. But that's part of that shifting of roles, that we step into these roles that feel like we should become the parent. And I remember early days of ACAP that a woman who was at one of the programs said, how do I get my mom to listen to what I am saying? Because, with my child, they listen to what I'm saying, and I can't get my mother to do that. And it was like, well, not going to happen probably, but that's a real issue with this. We've talked about the emotions. One of the things that we know is that there can be a lot of guilt. This feeling of guilt that we should be able to do more, but we can't. We should. This guilt of, I need to be over here with mom and dad, but I also need to be at home with my spouse or my partner and my kids, and I need to have time for me. And that really, everything kind of bumps up against each other, but that can be really frustrating and really difficult to kind of unpack all of that and be healthy about that. We've talked about several of these things. The thing that I think needs to be stated, sometimes we get into the caregiving space and we feel like it is all doom and gloom. The reality is that it can be enormously, it truly can be enormously life-giving to the caregiver, in that it can strengthen the bond, strengthen the relationship between the parent and child, adult child. And I watched that with my own mother, with her mother. Very difficult relationship all of their lives. But when my mother was the caregiver for my grandmother, it became a really sweet kind of time for them. It also can encourage a level of empathy and understanding that we may not have had the opportunity to experience otherwise. But I think as much as anything, it also can create a sense of purpose for people. And it's not that we don't have a sense of purpose in other realms, but there is something really profound about being able to, as I say, walk our loved one home. To be with them, to hold their hand, literally or figuratively, as they are moving toward the end of their life.
Thank you for pointing out the positive, because yes, it is rewarding too. I know with my own experience when my mother was declining, because we were fortunate to find an outstanding assisted living, all her needs were met. The time we then had together, it was so much more pleasant, because we didn't have to worry about the house or other things. We got to spend time together and enjoy each other. And I think finding the right place and support so you can focus on the positive and enjoy that new time, it made a huge difference for the entire family.
Right. And I've heard people, Kathy, talk about that when they were able to move to that place, whether that's a literal place or that figurative space, that it allows them to, again, become the family member. Mm-hmm. They're not trying to be the housekeeper and the cook and the medical person and the everything else. It allows them to move into this really nice place of just being able to interact with their loved one.
Exactly.
That is so true. That's exactly what happened with me, my sister. I was able to be her sister again when she got situated in a wonderful community. It makes such a big difference.
Yeah.
Oh, absolutely. But along with that comes the need, and I want to underscore need for that support and for those resources, to be aware of those resources. And that's one of the things that I know that Lorraine and her team are really strong on. And what we try to do with all of the ACAP chapters is, where are the resources? And when I first started, it was like, if I had one person, and I was very fortunate to have one other friend who was sort of walking through the same thing, and we were able to talk together, and we got it. We understood what the other was going through. So definitely try to find at least one other person, as well as the community supports.
Okay. So can we just go through, we've discussed the stress, but we were also talking about the positive side of this. Like, can we go through some of the common pitfalls and strategies that you see, not just in New Jersey, but everywhere?
Right. Lorraine, you want to speak to that first?
Sure. I think it is one of the things what we were talking about is taking on too much, not reaching out for resources, thinking you're Superwoman or Superman and you can do this all on your own. You got kids, you got a parent you're taking care of, no problem. And a lot of people don't get help because they say my parent won't allow help. Mm-hmm. But you still have to try. There's still other ways you can do it. Or if you need more time with your parent, then get help for yourself in the house. Mm-hmm. So you're not doing something in your life. Get help with something in your life, so you have more time to help your parent.
That's a great point.
Try to do everything.
Right. Yeah, I think another would be it's that proverbial put your own oxygen mask on before you put it on somebody else. It's we cannot neglect our personal life. We have other people in our lives. We have to take care of ourselves. The statistics are that so many caregivers compromise their health, physical health, emotional health, mental health, because they are caregivers. But instead, for them to take care of themselves is really important. So that's taking time. Even if it is 5 minutes in the day, take those few minutes just to have a bit of a reprieve and a respite. Keep up the hobbies, keep up the interactions with people. Goodness knows, do something in terms of movement. It doesn't have to be, go power walking, but do something to keep your own self moving and exercising.
And the other thing which we talked about somewhat a little bit, touched on, was sibling conflict.
Yeah, I want to hear more about that.
That is so true, and I hear it from the people that come to the meetings, and how well, I wanted to take care of this, but my brothers refuse to do that, and they won't let mom on that medication or whatnot. And but you're the one who's taking care of them, but they want to tell you their opinion, which is always a big conflict. And then I have so many, I hear from a lot of the assisted living communities and that the conflicts that they see is just ridiculous. That, it's their parents, it's the parents' money, it's the parents' life say if they want to go into the community or not. And the children seem to have opinions on that, where it should be their parents' decision and what they want to do or not do, and provided they are, if they want to stay home, if they can, then they can. But don't let them tell them not to go into the community, because you don't want them to Unfortunately, it comes to money, and that's a sad thing.
And I think like some of that, as you said earlier on, it's the lack of planning. Things, they're in crisis mode, and it sounds like more planning discussions before there's a need for help or intervention would, maybe alleviate some of these things. If the family talks, the siblings all hear the same thing. Hopefully, if needed, when the time comes, they're more in alignment and agreement.
That's so true. I do a workshop with the seniors themselves. And one of the things is do you make your plan? You don't have to do it, but have it there, have your plan B there. And then one of the things is, now you're going to write a letter to your family down detailing them what your plan is.
Oh, excellent.
So they know. Because sometimes they know what their parent wants, but it's not always what their parent wants.
And with our talking about this, it just occurred to me that one of the most popular programs that ACAP offers is, and the old name was 5 Legal Documents That Everyone Needs. Mm-hmm. But it is this whole thing of planning and making sure that people are making their own decisions, and not only owning that, but making sure that the family knows about that. Another thing that happens a lot, I think, is that because it's mom and dad, those boundaries sometimes get really kind of fuzzy. And so making sure that people know that we as caregivers are asking parents to do exactly this, to make those decisions, and to make sure everyone in the family knows what their decisions are. Mm-hmm. But to have that in writing, to have those wills and living wills and all of those documents ready so that there can be no question when that time, or if that time comes, that everybody knows exactly what their wishes are, because they are in writing. It's not just, well, they've told one person. There's a whole lot to that legal document stuff, and to those decisions, and to those blurred boundaries with parents and with siblings, making sure that everybody knows what they are trying to do and what their role is, and that everybody is communicating about all of that.
Yeah. And I'm going to share on our screen here. We've had other aging insights and webinars about that with the Conversation of Your Life in New Jersey, and some of the advanced planning groups. That information and recordings can be found on our website as well. So I want to ask you both, as we wrap up here, if you had just one piece of advice, because we've covered a lot, but if you had one piece of advice you would give to adult children of aging parents, what would it be?
Frances, you want to go first?
Mine is to be prepared, but be prepared for that to go completely out the window.
I love that one.
Because invariably somebody can plan. They've talked with mom and dad. They know what mom and dad's wishes are. But, and everything is bopping along, fine and dandy. And we think that we're on a good path. But then invariably something will happen. And whether it is a sibling who has a different perspective, or whether our perspective is different from our parents, or, any number of things. Yeah, have a plan, definitely plan, but be ready for that plan to go completely out the window and have to start over.
So a plan, but also flexibility.
Yes,
right.
Yes.
And Lorraine?
And mine is very, very similar. You see, we're on the same road here, track here. It's plan for the what ifs before the what ifs happen. It is. It's all planning. And I know us as a sandwich generation, it's just so busy that you don't think you have time to talk to your parents about these things. But now is the time to open up conversations.
Yeah.
Yes. Before they're in the hospital, before that fall, or that, not finding your way home. Yeah.
Well, I really appreciate you joining me and for what you're doing, I mean, across the country, but also bringing it here to New Jersey. I'm so glad that Lorraine, you've started this up in Bergen County and that there are chapters opening down in Burlington and Mercer counties. And we hope that we have more of this and spreads throughout the state. And we're going to put up on our website here, your website, where people can find events and other information. We really encourage people to reach out and to get involved. And again, thank you for joining us and for all that you're doing to help the adult children of aging parents.